Hello everyone. Children of all ages can become ill with COVID-19, but most kids who are infected typically don't become as sick as adults, and some might not show any symptoms at all. Know the symptoms and signs of COVID-19 in babies and children, and why children might be affected differently by COVID-19, and what you can do to prevent the spread of the virus. Today I have the pleasure of chatting with Dr.Mally. He's currently working in New York University School of Medicine as an attending neonatologist and associate professor in the Department of Pediatrics. Dr. Mally is the chief of the Division of Neonatology at New York University Langone Medical Center and Bellevue Hospital Center. He is also the director of the Neonatology Fellowship Training Program and is the director of the Residency Education for the Neonatology Division at New York University School of Medicine. Dr. Mally has extensively published research articles on topics ranging from morbidities seen in late preterm infants to manifestations of COVID-19 in the pediatric population. In this part 1 of the series, find out from Dr. Mally, who has first-hand experience of dealing with children affected by COVID-19 in New York during the first and second wave, about the preventive measures you can take to prevent the transmission of the infection. And we'll also be discussing various scenarios such as, can vaccinated parents transmit the infection to the kids? Can kids act as super spreaders and transmit the infection to the adults? And how a COVID positive mother can take care of a child. All right. Good morning, Dr. Mally. I would like to thank you first of all for taking time off and addressing this pandemic and its effects on the pediatric population. So thank you very much for being on this channel and for enlightening us.
Thanks, for having me. It's my absolute pleasure to share my experience with COVID-19 infections in the pediatric population.
Great. So I have a few questions these questions are from the internet, and I've asked a few of my colleagues also. So these are actual questions which are of great concern to parents here, especially in India. So starting off, most basic question, what is the best way to prevent transmission of COVID to kids?
That's a great question, Dr. Arapa. So I think it's very important for all parents and household members to understand the basics about this virus. And I strongly believe that if one understands how this virus functions, how it causes harm in the body, and then it'll make more sense in a basic way to understand the different preventative actions that you take at home to prevent this infection spreading from one individual to another. So the question is, what can we do to prevent infections at home, right? That is spreading at home. So the best way to do it is, number one is to try to find out if anyone is infected at home. So if there is an individual who's infected, the first thing always, the best thing to do is to try to isolate that person at home so that you can prevent that virus spreading within a household. Small things like wearing a mask, social distancing, and probably can quarantine in a room, in a bedroom in your home. The second most important thing is always try to identify the high-risk individuals at home who have a potential of being very sick if they get a COVID. And sometimes we tend to forget that. For example, you can have your grandparents, you can have senior citizens who are more than 75 or 80 years old, or you can have other household members who have an underlying disease processes, for example, or disease conditions like, let's say, asthma, let's say diabetes. Now, they are the folks who are at higher risk of infection and the severity of COVID. So we should be extremely careful to make sure these high risk folks, individuals in your home, to specifically to be quarantined or to create a separation from a person who's already infected at home. So the key points are always is try wearing a mask, number one, trying to quarantine in a bedroom, number two, and number three is hand washing, which is so super important. And it is very essential to understand the fundamentals of hand washing. And I always say to the parents of my pediatric patients is when you hand wash, right, the hand washing should be at least for 20 seconds. You can count till 20, or you can ask your child to sing happy birthday, right, as a song. And by the time the song is over, it's almost 20 to 25 seconds. But the key essential is to use soap and water or any other hand washing detergent with almost 60% alcohol. And the important thing is you have to nicely scrubs in between your fingers, under your nails, but the most important is count till 20, right? So it is called as efficient hand washing. So these are the basic fundamentals that's going to prevent spread of an infection. The second thing, Dr. Adapa, is one is washing your hands, every household member. And the second thing is trying to convey the message to all members, right? Because if one gets infected and it spreads to the other, then it is a very contagious environment you're creating. Try not to touch your face. Try not to touch your eyes or your mouth as much as possible. For the kids, less than 2 years, the CDC in US recommends not to use face masks because it is a risk for suffocations and life-threatening events. So usually we don't do that. And less than 2 years, we can't tell the kids not to touch the face, right? And that because that's the developmental milestone. When they're 1 year, 12 months or 14 months, the first thing they do is they'll take a toy and put it in their mouth, right? So there's some basic common sense logic preventative actions at home to keep the surfaces clean, especially the areas which your 1 or 2 year old is going to touch, the toys, the door handles, or anything like that has to be cleaned at least once a day, wiped clean with soap and water or any other detergent. So I would say these are the basic things that you can actually prevent an infection spreading from one person to another within an environment, within your home. The last thing I would say is ventilation is very important. We sometimes tend to close all the windows, right? Yeah. Keep it open. Because at the end of the day, it's recirculation. If there is a virus, if it is there in your, as we know and as you've read in the news, 6 feet, you have a sneeze, there is X amount of virus in your environment, right? And if another individual keeps inhaling that over and over again, then you are exposed to an increased viral load. Keep the windows open so that you have a very good cross ventilation. Right.
That's a very good answer. I think a few basic points, but sometimes we tend to forget these core basic points, and that's how we end up spreading the infection. All right. So next question: if both parents are vaccinated, can they still transmit the infection to their children or their kids?
Great question. So the thing we'll have to understand is what does the vaccine do and what kind of protection they give to any individual. So when both parents are vaccinated, different vaccines have different efficacy rate. What it means is a percentage of total protection. Overall, what we understand with the research that's been done is 90 to 95% of efficacy a vaccine has on an individual. So there's a protection of almost 90 to 95%, right? So, but there is that 5% what we call as the breakthrough infections. So even though a parent is vaccinated, there's a 5% chance that that parent can get infected, right? Now, even if they get infected, if they are vaccinated, the seriousness of an infection is usually very mild. It's not very severe. The severity is less. the answer to your question, those 5% who have had a breakthrough infection, maybe even asymptomatic, but they may be carriers for the virus during the incubation period. So short answer, yes, that even though both parents are vaccinated, for whatever reason, if they are infected, during the incubation period of 1 to 14 days, there's a good chance that they can transmit the virus.
All right. Yes, that's good to know, because many people, they do get, they have the notion that once you're vaccinated, you're completely safe.
Right.
So it's a good, always remember to always maintain the basics of, wearing the mask and maintaining social distance. All right. So yes, so I just want to go over a couple of scenarios at home, which is generally what I'm seeing in India. If both the mother and child are COVID positive, can she continue to take care of a child?
If both mother and the child are COVID positive, yes, absolutely. So as my understanding from your question is, this is a mother and the child is
positive and the father is negative, yeah.
Is negative, absolutely. So again, the main ingredients about safe practice over here is that you should still continue to wear a mask. You should still continue to distance yourself from the individuals at home who are not infected.
Not infected, yeah.
And the care, they should continue to have the normal care that they give at home to the child.
So should they isolate themselves? Basically, are you saying the mother and the child, they should isolate themselves from the rest of the family?
The mother and the child is the basic thing is the persons who are infected in any household should try to quarantine themselves in the bedroom.
Yeah.
So over here, if the scenario is both mom and child are infected, then it would be highly recommended that both mother and child are quarantined in the same bedroom.
Okay.
And then the key points is to follow through the infectious preventive discussion that we had just a while ago.
Yes.
Continue to wear a mask, have a well-ventilated room, make sure hand washing, and also is that simple household precautionary thing, whereas the mom and the child to make sure the utensils that they use, the towels and the bed sheets and the clothes should try to keep it separately and wash it separately so that there won't be any cross-contamination.
Right.
Because the whole goal over here is to make sure whether it's a mom, the child, or any other individual, if there's an index case at home who's infected, your first goal is trying to quarantine them in a space that works for individual families, right, so that you prevent cross-infection to other folks. The second goal is to monitor mom and child very carefully, which we will talk a little later on, looking at clinical symptoms and looking at the progression of the disease. Most of the time, hopefully, self-quarantine, infections, usually 4 to 5 days, it peaks, then it goes down, and then it disappears. Yeah. All good. If there's any other clinical signs that is suggestive of escalation of the disease process, then obviously you need medical attention.
Sure, yeah. Perfect. So the other scenario, like I was saying, so what if the mother is COVID positive and then the child is negative? Can she continue to take care of her child?
And how old would the child be?
A child would be, say, maybe less than 2 years.
Less than 2 years.
Yeah.
So here again is that if the mother is positive and the child is negative, as you say, the good practice here would be is that if there are other adult provider at home, who could be the father of the child, it could be uncle, an aunt, or a granddad, whoever that is, right? It is safer and better to quarantine the mom in a space that works for the family.
Right.
Try to keep the child away during this incubation period. Because again, the mom can transmit the virus to the child. Right. And the main goal over here is to prevent the child getting infections. And the mother, should follow all the infectious preventive protocols that we just discussed.
Sure. All right. And the last scenario is a very unique scenario. What if the child is COVID positive and both the parents are negative?
Absolutely. So if the child is positive and both the parents are negative, or, and if there's no other
option to
but the point is you need an adult to take care of this young child.
Because the child is positive, so doesn't
Exactly. But only thing you'll have to remember is we can talk about the symptoms in the child a little later. But though the child may be asymptomatic and for whatever reasons was tested and has come back as positive, always remember the child is still the carrier of the virus during the acute incubation period. So obviously the mom and dad will be taking care of the child, which is so super important. But taking all the infective prevention protocols is the most important thing over here. And that is wearing a mask, hand washing, as I said, for this 20 seconds and proper hand washing. Most importantly is sometimes we tend to forget is we always live in a household where you have, as I said, high risk individuals. You may not have, that's great, but if you have, think about it, because they are the folks who can get the infection from the child, right? So again is mom and dad, and try to keep the child in an area where you can contain the infections as much as you can.
All right. So, I mean, that's a nice segue to the next question, because, when I was in UK, there was a big thing for schools reopening, because the idea was children, do not spread this virus. They are not super spreaders, etc. So they were, even though everything else was closed, the schools were open. So are we saying if a child gets infected, they can still spread the virus to adults?
Absolutely. Absolutely, because end of the day, it's the same virus. It replicates in the same way, right? And although the child is asymptomatic, right, or symptomatic, they can still spread the virus.
Right.
The other caveat to this is, now, could they be a super spreader like an adult? The answer, usually we don't know, but the answer is they may not be as contagious when compared to an older individual. Because, and depending on the age of the child, if it is less than 1 to 2 years, they usually don't have too much of cough or sputum and secretions, right? So usually it's a droplet infections. So if they are, more than 2, 3, 4 years, yes, then the viral load can be seen in the droplet infections. One of the things always to also remember, and because as we're talking about pediatrics, we have different age groups here, right? We have 0 to 1 month, 1 to 6, 6 months to 1 year, especially 0 to 6 months, right? You have a caregiver changing the diaper very frequently and taking care of this baby. Now, this virus is also known to spread through feces and stool, because how the virus, as we all know by now, there are certain receptors. It's like a lock and key mechanism, if you will, where the virus will go to this receptor, attach to the cell, and that's how it can enter the cell. And these receptors are present in your epithelial cell in the lungs. That also is present in your gastrointestinal tract. So the virus can also go into the gastrointestinal tract, and that's one of the causes of diarrhea and vomiting. So a newborn, 2 to 3 to 4 months, can be, if is COVID positive, can transmit that virus through the stools. So the adult caregiver should be very careful when changing the diaper and making sure and extra precautions about, one is keeping the surfaces clean before and after changing the diaper. More importantly is hand washing.
Hand wash, right.
In the next part, Dr. Mally touches upon the symptoms of COVID-19 in kids and the management, the danger signs to look out for, and the stages of treatment during hospital admission. We will also be discussing about children with underlying medical conditions and what precautions they need to take. Do like and subscribe to my channel so that you can be notified in the future whenever I put up more relevant content. Thank you and stay safe.